Urology is a health care that deals with the diseases of male and female urinary tract, kidneys, ureters, bladder, and urethra, and other organs that are able to make a problem in the urinary tract, like prostate. In the practice section of urology, you mainly deal with the 5 subjects, which are renal stone, instruments used in the urology, investigations, and 2 important health problems, which are acute scrotum and benign prostatic hyperplasia, and finally, urinary symptoms. Renal stone is a solid piece of material developed in the urinary tract. Generally, urine consists of water, which is solvent, and particles, which are solutes, which are any end products of metabolism that must be excreted from the body. Renal stone will be formed when this solution becomes too concentrated, either because of increasing of the solid materials or decrease of solvent, like in the case of dehydration. So it's a stone there. How you recognize it? Patient usually has a flank pain plus minus hematuria, which the pain is usually colic in nature, particularly if the stone goes inside the ureter. If the stone is in the ureter, sometimes the pain has radiation. For example, if the stone in the lower part of the ureter, the pain radiates to the suprapubic area. And if it is in the middle part, it radiates to the iliac fossa region, which sometimes is misinterpreted as acute appendicitis. If secondary infection occurs, which is usually due to obstruction of the urinary tract by the stone and results of the retention of the urine, which provide a good environment for overgrowth of bacteria, other symptoms appear like fever, urgency, and dysuria. So the symptoms of the renal stone is flank pain plus minus hematuria, sometimes has radiation, sometimes associated with the infection. Management of the stone depends on the size of the stone and its composition, which means which type of the material produces the stone. If the size of the stone is lesser than 8 mm, it just needs a conservative management. However, if the size of the stone is greater than 8 mm, we need intervention. Intervention for renal stone. Either we treat the stone from outside the patient's body, extracorporeal means outside the lumen, or we treat it from inside the urinary tract. Open surgery for treatment of the renal stone is more historical and nowadays very rarely done. If the stone is greater than 20 mm or greater than 800 Honsfield, we do endoscopic intervention, which either we go to the stone from above using PCNL, or we go from below using RIRS, retrograde intrarenal surgery. Conservative management of the stone include analgesia, rehydration because sometimes the patient has vomiting, antibiotic if secondary infection occur, alpha blocker which cause smooth muscle relaxation in the urinary tract and help relieve pain and passing stone more easily, and alkalinization of the urine because some substances are more soluble in the alkaline environment. Regarding Iswell, as we said, it uses for stones smaller than 20 mm and lesser than 800 Honsfield. Before talking about the contraindication of the Iswell, as general, contraindication of the most of the procedures, especially urological procedures, are bleeding tendency and infection. So contraindication of the Iswell, bleeding tendency and infection are general contraindication. We just expand these two to cover more contraindications because there's a lot of contraindication of the Iswell. So instead of saying bleeding tendency, we can say cardiovascular complications that include bleeding tendency itself, uncontrolled hypertension, and the patient who has pacemaker should treat him with caution. It is not absolute contraindication, but it is better during the procedure a cardiologist present, because sometimes Iswell will cause failure of the pacemaker and arrhythmia. And calcified aneurysm, because there's a lot of the tension of the wall of aneurysm, and the strength of the wall depends on this calcification. When we use Iswell, this may distract the calcification and may cause rupture of the aneurysm. If the stone causes obstruction, there will be urinary retention, which is prone to infection and hydronephrosis. Some other contraindications include these related to the female, like pregnancy, which is absolute contraindication, and lower ureteric stone in the young female because it may damage the ovary. And if the patient is too obese or have musculoskeletal problem, it is hard to place them on the table. Complications of ISWL. Just like contraindications, we have some general complications of any surgery or procedure, which include bleeding, infection, damaging adjacent organs, plus in the urological procedure we can add pain. So complications of ISWL are infection, but instead we say sepsis, bleeding that represent as hematuria, damage to the adjacent organ like pancreas and liver, pain, and finally, because it is minimal invasive procedure, it may fail to distract the stone. Regarding RIRS and PCNL, as we said, they are used for stones greater than 20 mm. Complications of RIRS are bleeding, infection, damage to the adjacent organ, pain, and also failure of procedure. And complications of PCNL are same general complications, which are bleeding, infection, damage to the adjacent organ, and pain. Ureteric stone management is similar to the renal stone. If the stone is smaller than 8 mm, it just needs conservative management. If it is between the 8 mm to 20 mm and its hardness is lesser than 800 Hounsfield, we can use ISWL. If the stone greater than 20 mm, we use endoscopic intervention, which have two types. Remove the stone directly or just break down the stone to pass through the urinary tract. If these two failed, then we can push the stone back to the kidney and use PCNL to remove it.